Hi, we're here with Dr. Michelle Bache. She is Vice President of Medical Affairs at Elkhart General Hospital. Dr. Bache, this is our weekly update. If you could tell us what's going on in Elkhart County and really across our region in terms of COVID.
Hi, thank you, Heidi. Thanks for having me back. Yeah, so we took a break last week. We were, didn't do an update, and I just want to take this opportunity to make sure that the community knows that this is not something to take our eyes off of. We were really following a slow but nice downward trend, and unfortunately now we are starting to see things heat up slightly. When we look at our percent positive cases, which we discussed last time, remember our goal number, we would like the percentage of tests that we do 5% or less to come back positive. So that's our goal. Last time we were starting to show some improvements. We got down as low as 11.4% for our 7-day moving average on that. So we were definitely moving in the right direction. Today, the 7-day average of our positive tests is up to 13.9% again, and that has just been kind of slowly creeping up over the past week. So that's a leading indicator. That is something that will indicate when things are starting to heat up in an area. So we have to watch that very, very closely.
So that's Elkhart County. St. Joe County, you were mentioning to me a little bit of a creeping up there as well.
Yeah, so they are seeing a similar situation. They actually were doing, a very excellent job. They were down to 3.6% on their positive test results. That was back in mid to late June. And now today we're up to 8.3% of their tests being positive. So, definitely creeping up. And once we get above 10%, really we get pretty concerned about that. So we want to see things holding steady at 5% or less.
Okay, well, hopefully, right? Fingers crossed we get to
Yeah.
that point again. Elkhart General, then tell us what's going on. What's the situation there?
Elkhart General has been pretty constant. We did have, I guess maybe 2 weeks ago now, we had a pretty big increase in our number of ICU patients, and that was a little stressful for several days trying to deal with that. Currently, we're about half and half as far as our ICU COVID patients versus non-ICU COVID patients. Our census overall for COVID patients and our dedicated COVID unit has been fairly constant. I have a lot of people ask me out in the community, oh, do you have patients? Do you have COVID patients in the hospital? Do you have a lot of them? The answer is yes, we do have COVID patients, and we have had them, and we will expect to continue to have them. It's not an insignificant number. And I think it's hard for people, if you don't really know somebody who has been personally affected by this disease, it's easy to just pretend it's somebody else's problem. But there are definitely many people in this community who have been terribly affected by this, and obviously you can look at our deaths and things like that too. We really need to take it seriously and continue to be diligent with masking and social distancing, hand washing, all these good things we keep talking about.
Good reminders. What is potentially on the horizon now that we were talking about the effects of the 4th of July? And
Yeah.
now that it's been, several days or whatever since,
Yeah,
I mean,
I think
where are
that's
we
some
at?
of I think that's some of the increase that we're seeing. So, over the end of last week and into this week, that some of that is the results of gatherings that occurred over the 4th of July. And I think a lot of things are starting to happen now that, we want to be able to happen, but we have to recognize how to do it safely. So, for instance, a lot of the schools starting, in-person practices and training and things like that. I mean, I think everybody's trying to be really diligent, but, this is, when you do these things, it does come with some risks. So we're going to have to be very careful about monitoring what is happening in our community as we start to, do more and more and more things. And we all want that to happen, but we need to make sure that we can do it as safely as possible.
So again, masking, social distancing, and what should people be on the lookout for if they're just not necessarily feeling the best? when is it time to go get tested? Can you give us that reminder?
Today, go get it right away. Just, I mean, really, we can't over test. We really can't. I mean, I'm seeing a little bit of a decrease in the number of tests that we're running too, which is concerning to me. So, we want to continue to test. The only way to understand and to control the infection is to know early who has the infection so that we can contact trace, we can isolate the cases, and we can really try to stop the spread. Without all those pieces in place, it's really going to be difficult, if not impossible, to control this.
And symptoms, what should people be on the
Yep.
lookout for?
So the
When should you go?
fever, yeah, the typical, we say influenza-like illness. So it's, fever, body aches, cough, shortness of breath. The very specific symptom for the coronavirus is the loss of taste and smell. So that is pretty, subtle. But if you notice you're not tasting things or you're not smelling things, that could be the only symptom that somebody has. So that doesn't mean that you're not infectious, and you should absolutely go get tested so that you can know and notify your contacts.
Thank you for those reminders, and we'll check back in with you again soon. Thanks so much.
Okay, thank you, Heidi.